Okay, we're ready for another week.
All right, so if anyone's new, go ahead and chime in and let us know how you found out about the classes. But I think recognize most of the names here tonight. Is there anybody that's new? Oh yeah, do you have a question, Sarah?
Yeah, a new person can chime in first. Was there somebody?
I don't think so.
So I was just going to say that, I started listening to the China study that was on the book group, and I just want to say that, and I think tonight is going to connect to that, I mean, not just to the idea of it, is that, he's very scientific. I'm only on the third CD, but I just have to say that I got such a feeling of joy, like a feeling of, take away the scaredness of, what could harm your body. It gave me a feeling of empowerment, and I was so grateful for that. It just was like, I just have to say, all these years, people that got this and that and the other,
Well,
um,
I have to say that after the clean energy, this book was very refreshing because it tells it like it is.
yeah, it was quite amazing. It really feels empowering, right?
Yeah.
Yes,
Yes.
that it just, yeah, and take away a bit of the worry about the environment or this or that, I mean,
Yeah.
of course we could still be worried, but I'm just saying it gave you it empowered me.
Well,
And
I used to worry that I might get Alzheimer's or have a heart attack because that's what my
yeah,
ancestors did, and I thought, well, but going whole food plant based, I don't worry at all.
yeah,
I
it's
mean, I
amazing.
don't deviate from my path at all.
Yeah, it's amazing. Thank you for everything everybody's doing here.
Yeah.
Thank you.
I
Thanks for
knew.
chiming in.
Um,
Oh yeah,
hi, hi. I'm Carrie. I'm new. I didn't. I'm not showing my video right now, but I went to the class at the Y on Sunday, and I am not new to whole foods, plant-based diet, but and I generally follow that. But recently, I've been just trying to get more strict with that. So yeah, so joining these classes to be motivated just a little bit more.
great. Thank you. Any other questions or comments before we get started? With heart disease is our topic tonight. With Kristin Linzmeyer, she did this talk on Friday night at the Irving Grange, and was kind enough to come back and repeat it for you guys, for all you guys here tonight online.
Thank you.
All right.
All right. Do you want to talk for a few, just let me know when you want me to share the screen if you want
Go
to
ahead.
chat first.
Let's get started, I think,
Okay.
Scott. And maybe everybody could mute just so there isn't a lot of background noise. So so we're going to talk a little bit about cardiovascular disease and how it's mostly about the whole food plant-based diet and how it can help decrease your risk of cardiovascular events. But it's kind of a two-part discussion. One is to kind of go over what are we actually trying to. Can, you, can, can everybody mute, please? There we go. So the first part is going to go over various diseases that that we're trying to avoid. So go ahead, Scott. Let's go ahead and advance. And I think you just want to advance to. There we go. So cardiovascular disease is the leading cause of death in our country. I'm sure most of you are aware of that, and it includes the whole vascular system. Includes things like strokes and heart attacks and peripheral vascular disease, as well as erectile dysfunction. And that may come as a surprise to some people if if somebody's never had any inkling that they might have cardiovascular disease, but they have erectile dysfunction, we call that the canary in the coal mine because it is a form of vascular disease. It also can include certain types of abnormal heart rhythms called arrhythmias and congestive heart failure. And the pathways, the pathophysiology, the disease pathways that lead to cardiovascular disease are similar to other disease processes, like for dementia and for kidney disease and for development of cancer. So, we have this saying, what's good for your heart is good for your head. So anything that you're doing, good, healthy lifestyle choices and habits that are good for your heart and your vascular system are usually going to be good for your brain, to prevent dementia and to prevent strokes. And it's going to be good for your kidneys and your liver and help reduce cancer development. And so, that what's good for your heart is good for your head, is good for all other organs in your body. Go ahead, Scott.
Eat up. Eat up. Rate up.
Oh,
Are
make
you
sure
saying
everyone's
rate up?
muted. Mute yourself, Marcia.
There we go. So, out of the dying prematurely, diet and dietary choices is the number one cause. And up there is physical inactivity and smoking, but diet is the number one cause of premature death and disability. And I just use these pictures here. There's an actual heart attack cafe in Las Vegas. And when you go there, if you weigh in and you're over 350 pounds, they let you eat their single bypass burgers for free. And the one on the left is I think it's their biggest one. It's their 7 or 8 patty burger. And all of their burgers are fried in lard. And their French fries are fried in lard. And they call their French fries flatliner fries because when your heart stops, it flatlines. And so that's what they named their fries after. So I just, this is kind of the standard American diet. Maybe not everybody's eating a 7 bypass burger, but this is kind of what is known as the standard American diet, or SAD. Go ahead, Scott. So how does diet harm us? So the typical standard American diet, which is high in animal-based foods and high in ultra-processed foods, tends to have a lot of trans fat and saturated fat. And these are very inflammatory, disease-causing nutrients. Saturated fat is a direct inflammatory factor. So after you eat a meal that's high in saturated fat, let's say it is a burger and fries, the worst damage to your body, to your vascular system, is within about 4 hours of eating. And that's when the highest amount of oxidative stress, which is basically causes a lot of inflammation and damage to your artery wall, happens. And so, I've heard this comparison before, probably from Scott and Charlie, that, if you twist your ankle and your ankle gets all inflamed and swollen, and you keep damaging it over and over and over again, you keep hitting it with a bat or something, and you damage it over and over again, it's going to stay chronically inflamed and chronically damaged. Well, if you eat a meal and the worst damage to your vascular system is within the next 4 hours, what happens about 4 hours after you last ate? You usually eat again. And then 4 to 6 hours after that, you eat again, because most of us eat about 3 meals a day. So it's like you're chronically damaging your vascular system if you continue to eat a very high inflammatory diet like that all the time. And then the other way diet harms is through the intake of dietary cholesterol. And dietary cholesterol is only found in animal products. There's really very little, if any, cholesterol in any plant-based products. Essentially, it's none. And so you're only going to get cholesterol through animal sources. Okay, go ahead, Scott. And so I'm just going to show the next two tables briefly, but basically this was from the National Cancer Institute. They found that the top food sources of fat, saturated fat in the US population, number one is cheese. And it's not because per serving there's more saturated fat in cheese than perhaps number 8, which is burgers. Per serving, burgers probably have more, but it's because we eat so much cheese that is where our number one source of saturated fat comes from. Go ahead, Scott. And then as far as the top dietary sources of cholesterol, it's eggs. And again, per serving, eggs does not have the highest amount of cholesterol, but we eat a lot of eggs in this country. So eggs and cheese are kind of the top culprits. Go ahead. So what does our body do to defend ourselves from any of these toxins and these inflammatory factors? Well, one is we produce a wonderful substance called nitric oxide. And nitric oxide dilates our arteries, makes our blood pressure nice and low. It decreases the stickiness of blood cells, so your cells can't clot and clump together as easily. It decreases inflammation in the lining of our arteries. That's called your endothelium. And it decreases the plaque formation, the atherosclerosis that can clog up our arteries, as well as the smooth muscle formation that can start to form really calcified and thickened plaque. It also produces endothelial progenitor cells, which helps heal any damage in our blood vessels. It helps produce HDL, which removes the bad cholesterol from your blood vessels to bring back to the liver. And it produces short chain fatty acids. And this comes from fiber in our GI system, fiber plus the gut flora in our GI system. And together, short chain fatty acids are formed, which we'll get into a little bit later, but is a really wonderful substance that helps decrease inflammation and keeps our body healthy. And so eating a whole food plant-based diet will help our body help itself, and it's going to help increase all of these different factors that our body uses to defend against toxins. Next. So what are the things that really cause this atherosclerosis? Well, the building blocks for atherosclerosis is cholesterol, and then inflammation is what causes it to really flare up. It kind of exacerbates it because you can have cholesterol, the atherosclerosis, which is the building block for atherosclerosis in your arteries. It can stay there and be quiescent. It can be very quiet and not cause any problems until things start to heat up and get inflamed. So Scott, can you play that video? That should be a hyperlink there. So this is from Dr. Michael Greger, who is the founder of nutritionfacts.org.
The plaques in our coronary arteries, which can eventually burst, shut off our heart's blood supply, and kill us, are more aptly described as pimples, not plaques. They are inflamed pockets of pus, and it all starts with cholesterol. This is a diagram of the wall of the coronary arteries crowning our heart. And here comes the villain of the story, LDL, the bad cholesterol infiltrating the lining of our artery. It gets oxidized and triggers an inflammatory response. Your artery hangs a white towel out the window into the bloodstream, asking for help. The lining of your artery actually produces adhesion molecules to stick white blood cells called monocytes, zooming past, and suck them into the wall to try to repair some of the havoc cholesterol is wreaking. We never evolved to have so much cholesterol in our bloodstream, and it causes damage and inflammation inside the walls of our arteries. Other inflammatory cells are called into action, and it gets pussier and more inflamed and turns into a big whitehead sticking out like a zit into the blood flow inside our arteries. The blood's pulsating past and can rip off the cap, and you get a big squirt of pus straight into your artery. Blood rushes into the hole and says, "Hey, we know how to plug holes," and forms a blood clot, also known as a thrombus, that can close off the whole rest of the artery. And then we have the opportunity to visualize a cross-section like this of an artery on autopsy because you're dead.
So that's the top left-hand corner is where you could see the cross-section of that artery. You don't have to play it again or anything, but it's basically
In this
showing
video,
the whole artery is occluded. So kind of a graphic, rather disgusting video, but I think it gives you the point pretty clearly. Oh, go ahead next. Thanks, Scott. So this is an EKG, and many of you may have had EKGs. That's the electrical wires that they put on your chest, and they do a recording of the electrical activity of your heart. And so each of these spikes on the EKG is a heartbeat. And Scott, maybe you could point out those tombstones with your cursor. Yeah, so you see in where it says V4, for instance, there's like a big hill. Yeah, there. That is showing damage to the heart muscle, active injury from a massive heart attack to the heart muscle. And the reason it looks like a big hill, we call those tombstones, is showing how much injury is happening because of a massive heart attack. And so sometimes, an ER doctor might call and say, hey, Dr. Linzmeyer, we have somebody having a heart attack, and they have tombstones on their EKG. And it's because many people don't survive this type of heart attack that is just so massive. It basically can shut down the heart. And that's how it got that nickname of tombstones. Go ahead, Scott. So moving on to rhythm problems, atrial fibrillation is an arrhythmia, and it's the most common type of heart arrhythmia. And on the left side, this should be playing. I'm not sure why it's not playing, but on the left, doesn't seem to want to play, huh, Scott?
I'm
Okay.
clicking on it just in case.
That's okay. That's right. But basically, with atrial fibrillation, those two upper chambers of the heart are your atria. And if they're fibrillating, that means they're just quivering. They're not contracting in a synchronized fashion. And it can set you up for things like a very fast heart rate, where it's fast all the time and your heart never gets to rest. And it also can cause stagnation or poor flow of blood in those chambers. So these are some of the things that can develop because of atrial fibrillation. One is you can be very symptomatic. Two is you can have a stroke, because if blood sits around in the heart because it's not the heart is not contracting normally, a clot can form. And if the clot moves through your circulation, worst case scenario is it gets lodged up here in your brain, and you can have a devastating stroke. The other big problem we see from atrial fibrillation is congestive heart failure, because it's like your heart is running a marathon all the time. It never stops racing, and your heart needs to rest just like the rest of your body does. And so atrial fibrillation can lead to a lot of problems. So go ahead, Scott. Atrial fibrillation is really a disease of inflammation. Now, there may be a hereditary component and some genetic components that we're not all familiar with yet, but inflammation very much plays a role. High inflammatory diets, infections, even alcohol, excessive alcohol, and I don't mean necessarily alcohol abuse. It could be even just binge alcohol use can increase your risk of atrial fibrillation. They've even found that extremely high levels of exercise, like in ultra athletes, can lead to higher risk of inflammation. Other risk factors include high blood pressure, obesity, and even low carb diets. Carbohydrates, we'll talk about this a little bit further on. There can be really bad carbohydrates, which are the highly processed carbs, but complex carbohydrates are really healthy for you. And those are the ones that are found in fruits and vegetables and whole grains and legumes. And so low carb diets, if people are cutting out those types of foods, there's no benefit that they're getting from those very anti-inflammatory foods. They also can increase, because low carb diets usually mean that people are increasing their protein and fat, there's more oxidative stress, which can increase your risk of AFib. Next. This is kind of the worst life-threatening type of arrhythmia, and that's a cardiac arrest. The top line is a normal rhythm. It's a normal sinus rhythm, a nice steady rhythm and rate. And then the bottom is called ventricular fibrillation, and that's where your heart is beating so chaotically, it's really not providing any circulation. And this is life-threatening and will lead to death within minutes, if not seconds, if it's not shocked, if you're not shocked out of this. And this is, of course, the worst case scenario in things like heart failure or heart attacks or other forms of heart disease. Go ahead. And then finally, stroke. There's two main types of stroke. The one on the left is the clotting type of stroke, where you have all of that atherosclerosis and crud that clogs up your arteries going to your brain and leads to a stroke. And then the other one on the right is a hemorrhagic or a bleeding type of stroke, which can be just absolutely devastating and cause a lot of scarring. Go ahead. And because I thought this would be a good PSA for making sure that people get emergency medical attention very, very rapidly if there's any symptoms of a stroke, I thought that I would just give you this mnemonic of be fast. And so when you spot some of these signs, then or symptoms, then you need to call 911. So B is a loss of balance. If somebody all of a sudden can't keep their balance, they're having vertigo or they keep falling over. Eyesight changes. If somebody says they feel like a curtain is coming down over one or both eyes, or they lose vision in part of their eye, that's a symptom. Face drooping. If you have somebody smile, but only one side of their face goes up and the other one doesn't do anything, that's a sign that they could have weakness just on one side of the face from a stroke. Arm weakness, if you have somebody hold out their hands like they're holding out a platter, and then one hand starts to droop down because it doesn't have the strength. And then speech difficulty. If somebody has garbled speech or they're obviously trying to talk to you but no words are coming out, then it's time to call 911. Go ahead, Scott. So congestive heart failure can be hereditary. This is, I think, the last kind of this very brief summary of types of heart disease. And I think this is the last one I was going to mention. Congestive heart failure can be hereditary, but the majority of heart failure is due to other causes of heart disease, like heart attacks, like atrial fibrillation or other arrhythmias, like I mentioned before. High blood pressure can cause congestive heart failure. Valve disease, valve problems can. Even obesity and diabetes can. And then, of course, there's the hereditary causes. Go ahead, Scott. So the picture on the left is a nice normal heart, normal muscle thickness, and the heart is not dilated. And then on the right, you can see the heart is dilated and the wall is thinner. And there's basically two major types of heart failure. One is where the heart is really weak. And so every time your heart squeezes, it should squeeze out about 60 to 70% of the blood each time. That's called your ejection fraction. How much blood is ejected from your heart each time your heart pumps. And we actually give a range even bigger than that. It's about 50 to 70% of the blood is ejected from the heart. And then the other, so if you have a weak heart, sometimes your heart's only pumping out like 30% of the blood. So that's one type of heart failure. The other type of heart failure is where your heart's still strong. It's pumping out 60% of the blood, but it's really stiff. It's not able to relax very well. And that tends to happen more in very elderly people and actually is more common in women. Go ahead, Scott. So how do we prevent developing cardiovascular disease? Cardiovascular disease and a lot of the risk factors for this I think a lot of people have always assumed that it was just something that happened normally when you age. You're more, when you get older, of course, you're going to have high blood pressure and high cholesterol, and you might have a heart attack and you might have some of these heart issues. But that is not the case. And a genetic predisposition to cardiovascular disease does not mean that it's your destiny to actually have a problem with it. When it comes to cardiovascular disease, it's your genetic um, uh, predisposition to it is only thought to account for up to 20% of your risk. The rest of it is all through diet and other lifestyle factors, which means that the ability to prevent and maybe even reverse cardiovascular disease is very much in our hands, and it's in our ability to control. Go ahead. So I'm only going to mention briefly some of the evidence behind this. When it comes to looking at diet and other lifestyle factors that can help prevent cardiovascular events, um, it's really difficult to do certain studies where you assign one group of people a whole food plant-based diet and another group of people you tell them to eat whatever they want and then you follow them for 10 years. That's almost impossible to do because one, you don't know for sure what people are eating. Two, if you're asking them to recall what they're eating, their memory may not be accurate, or they may not tell you all accurate information. So the best types of data that we have when it looks at diet and nutrition and what's the healthiest are observational trials or epidemiologic trials where we look at large groups of people and we just follow them over time and let them do what they want, and we see those who have certain lifestyle factors that they follow or behaviors that they follow, whether that causes heart disease or whether it seems to protect them from it. So there's the Adventist trials, which are studied the Seventh Day Adventist populations down in Loma Linda, California, and that's one of my favorite, and I think one of the most helpful pieces of evidence that shows what kind of diet and lifestyle can keep you healthy. And the reason for that is Seventh Day Adventists tend to be very healthy people at baseline. Most of them don't smoke or drink alcohol. They exercise regularly, and they have a very strong community support system. And many of them, not all, but many of them are vegetarian or vegan. And so, what the Adventist trials did is they looked at Seventh day Adventists who were vegan compared to vegetarian, compared to those who ate meat, and followed them to see how long people lived. And lo and behold, the people who eliminated pretty much all animal-based products from their diet lived the longest, and were not didn't just live the longest, but were free of disease for the longest. So, and these are some of the other studies that looked at kind of a similar idea of which people developed diseases and what did they eat, are some of the other ones that I listed there as well. Go ahead, Scott. Here is a picture of an artery. And this is an example of Dr. Caldwell Esselstyn's study where he looked at people who had really, really severe heart disease and put them on a plant-based diet to see if he could reverse their heart disease. And the one on the left, the artery is being filled with a dye, and that dye looks white. So that's the artery that you're seeing that's lit up white in panel A. And toward the bottom of the artery, you can see it looks kind of moth-eaten, like there's a narrowing, and it's kind of where the Scott, I don't know if you could point out kind of where that diseased part is in the lower part of the artery. Yeah, right in there. And then this is the same person, and in panel B, 32 months later, he did another angiogram after they had been on a plant-based diet, no cholesterol lowering medications that we have today. And you can see that artery has healed itself because they went on a plant-based diet. That was the only change they made. So, I mean, this is just one person, but he showed this in dozens and dozens of people that you can improve or even reverse heart disease. Right, go ahead. So, we're going to talk, I kind of get into some of the details now, a little bit more about the types of diets and how much a whole food plant based diet can help you. But as far as giving you just some of the most recent evidence, this study, it's not even published yet, was just released in Chicago at the American College of Cardiology conference this year. It was in March, and they just presented this late breaking data. They looked at over 75,000 people who had cardiometabolic diseases. So that's cardiac disease, diabetes, kidney disease related to cardiac disease. And they looked at those who were on a healthy, that's key word there, healthy whole food plant based diet compared to those who were in the lowest category of a plant-based eating. So they put them in quartiles. So the lowest quartile, and then those in the highest, who ate the most of a whole food plant-based diet. And those who had the healthiest diet lowered their risk of dying from all causes, not just cardiovascular disease, but also cancer and other causes. Now, an unhealthy plant-based diet, so you can have a vegan diet and it can be really, really unhealthy because it can be filled with processed foods that are very high in sugars, oils, and salt. An unhealthy plant-based diet increased mortality, increased risk of dying by up to 28 to 43% compared to those who were in that lowest category. So it's almost worse to be on an ultra processed diet, even if it's vegan, than it is to eat some animal products. Go ahead, Scott. So here are some examples of plant-focused diets. And I say plant-focused because all of these diets, Mediterranean, DASH, Portfolio, Mind, and a vegan diet, emphasize eating more fruits, vegetables, and plants. But there's a different, I say it's plant focused because depending on the diet, they want you to focus on filling your plate with plant-based foods, but some of them allow for a little bit of meat or a little bit of dairy, maybe a few eggs, things like that. One of the most out of this group, the Portfolio diet, is probably the healthiest, and it is an entirely whole food plant-based diet that emphasizes soy products, nuts, and plant-based sterols, which is a type of fiber that decreases cholesterol absorption in your GI system, to lower cholesterol. That's what the Portfolio diet showed. But these are all, if your doctor ever told you to follow Mediterranean diet instead of the standard American diet, or do the DASH diet to lower your blood pressure, they're all great diets. They're great. But you can always make improvements of adding even more, or moving along the spectrum toward more of a whole food plant-based diet, and trying to minimize any animal-based products. The reason I put a question mark next to vegan is because of the next slide. Go ahead, Scott. When I don't love the V words, I call them vegetarian and vegan, because all that tells people is what you don't eat. And there's even a spectrum in a dietary eating pattern. Carbohydrates in general are very good for you. They're very good. They're very high in fiber, but I'm specifically talking about the healthy, whole, complex carbohydrates. So these are nutrient dense, but often low in calories. They're very high in fiber. They're high in vitamins, minerals, antioxidants, and phytochemicals that can turn them different colors. And examples are whole grains, legumes, beans, that's beans, quinoa, lentils, and then fruits and vegetables. But then there's garbage. And garbage are the carbs that are the highly processed simple carbs. those, when somebody says you should be on a low carb diet, that really is what they're talking about. You need to try and decrease the amount of garbage you're eating to help your body help itself. So these tend to be very highly processed or refined foods. Like I said, loaded with sugar, fat, and salt. They're nutrient poor, but often very calorie dense. And the examples here are sugar sweetened beverages, pastries, sweets, vegetarian ultra processed foods, trans fats, and tropical oils. So you can see I showed some pictures of Oreos and French fries. Those are vegan. Oreos are vegan, but they're not very good for you. Go ahead, Scott. So when it comes to kind of takeaway points or take home points for this presentation, one is to try and eat the rainbow. And so when you're filling up your plate with food for breakfast, lunch, or dinner, try and incorporate fruits, vegetables, whole grains, that sort of thing, that are as many different colors of the rainbow as possible, because then you're getting all of those different phytochemicals and micronutrients that all work together synergistically to help your body. Go ahead. So when it comes to when people want to know, well, what should I eat to help decrease my risk of cardiovascular disease? Well, we already talked about eating the rainbow, and you're going to see now in this very specific list of foods, these are foods of all different colors. And instead of dividing up, well, these foods are the best at lowering cholesterol, or these foods are the best to lower inflammation or to lower blood pressure. The idea, though, is that if you're getting a big spectrum of fruits and vegetables and legumes and whole grains, you're going to get enough of everything to help all of these components, the cholesterol and the blood pressure and the inflammation and all of that, if you just eat a well-balanced, well-rounded, whole food, plant-based diet. So especially walnuts and Brazil nuts among the nuts tend to be especially healthy. Brazil nuts are high in selenium, though, so try and keep those to no more than 1 to 2 a day, or maybe, a couple times a week, because you can get selenium toxicity, which my understanding is that it's the symptoms of this are very non-specific. It's like nausea and vomiting and weakness and tingling in your fingers and toes, kind of neurologic symptoms. Citrus, berries are superfoods. Blueberries, raspberries, pomegranates, acai berries, cranberries, apples, purple potatoes, mushrooms, onions, and garlic. Green leafy vegetables are also superfoods. And then, of course, beans, one of my favorites, very, very high in fiber, arguably one of the highest in fiber out of all of these foods. Go ahead, Scott. And then some of the strongest anti-inflammatories, turmeric is number one. I put turmeric in my smoothies and in my oatmeal and in soups. I put it in so many different things just to get a little bit of turmeric a couple times per week. Ginger, garlic, and certain teas are also very strong anti-inflammatories. And then what not everybody knows is that fiber is a very strong anti-inflammatory, because fiber, along with a healthy gut microbiome, produces short chain fatty acids. And the other foods that increase your nitric oxide levels, remember I mentioned the things in your body that can help protect or defend it from toxins, are nitric oxide. And there are foods that can increase your body's ability to increase nitric oxide production. And I had mentioned Dr. Caldwell Esselstyn. He's the one who was able to demonstrate that he could reverse heart disease with a whole food plant-based diet. I showed you the angiogram of that patient. He has it all memorized, this long list of greens and other vegetables that can help increase nitric oxide production. And I put in bold there some of the top performers. So Swiss chard, kale, spinach, arugula, and beet greens. But the others there are listed. There's the mustard and turnip greens, actual beets themselves, Napa cabbage, collard greens, Brussels sprouts. You can see the list there. And he mentioned that if you put a little vinegar, the acetic acid in vinegar, if you put a little bit of that on the greens, it actually increases the enzyme in the body that produces nitric oxide. Go ahead, Scott. So getting back to fiber, because fiber is something that we're really deficient in as a whole in our society. We worry so much in our society about getting enough protein, and protein is important. Don't get me wrong, but you can get plenty of protein in a plant-based diet. What we're not getting enough of in general is enough fiber. And I think the minimum amounts, it does depend on your age. It's around like 30 grams of fiber a day, and that needs to be increased over time. There's two different types. There's soluble and there's insoluble fiber. And your gut bacteria, healthy gut bacteria, process the fiber into short chain fatty acids. And if any of you want to read a really, really good book, I think this was already featured in the book club. Scott, is that correct? A Fiber Fueled? I think you already read it last year or the year before. Fiber Fueled.
I think so, possibly. I forget what all the different ones we've read.
Yeah, but Dr. Will Bulsiewicz is a gastroenterologist who's the author of Fiber Fueled, and he calls short chain fatty acids the most healing nutrient in all of nature. And what they do is they act as anti-inflammatories for your body. They have some anti-cancer properties. They help stabilize plaque, atherosclerosis. It's a really remarkable molecule. And so that is one of the reasons why fiber is so incredibly important in increasing it into our diets. Go ahead, Scott. And then finally, before we wrap up, I've spent pretty much the entire time talking about dietary information and how it can help your heart. And it is arguably the most important lifestyle factor that we should focus on to help prevent cardiovascular disease. But in lifestyle medicine, there are 6 pillars that have been identified as giving us the ability to take our health into our own hands, giving us agency in our health and to prevent disease. And I want to comment on the other ones just briefly, because nothing in our lives functions in a silo. So everything is related to everything else. The other factors, in addition to nutrition, is physical activity, restorative high quality sleep, avoiding risky substances like alcohol and nicotine, positive social connections or support system, and stress management. And when I say that nothing functions in a silo, I'm going to give you an example. If somebody is not getting adequate sleep, if they are chronically sleep deprived, and all it takes is a couple of days for it to really build up, what does that do? Because you're tired during the day, most people don't want to, exercise. They're too tired. So they're not exercising, which may lead to some weight gain. And it may also, because exercise is a great way to handle stress and a healthy way for stress management, people might find that they're not handling the stress in their lives as well. And because they're tired, they're more impatient. They may turn to substances like alcohol thinking it's going to help them sleep or it's going to help them manage their stress. Also, lack of sleep, especially chronically, has been associated with poorer food choices, nutrition choices, for a couple of reasons. One is it increases your brain's cravings for carbs, and the very processed carbs are often the things that are lying around that are easy to grab, like chips or candy or soft drinks or things like that. And it also increases our cravings for fat. What it also does, though, is it turns off the healthy appetite regulation system in our bodies. We have some hormones that help us regulate our appetite. One of them is called leptin. And when leptin levels increase, when you eat, leptin levels increase and it signals to your brain that you're full. So you stop eating. But when you're sleep deprived, it adversely affects your leptin levels. So your brain is not getting that same feedback that you're full and you'll tend to overeat. So, I mean, it can affect, you can see how just lack of sleep can affect all of these other components of our lifestyle in a negative way. And so that's why all 6 pillars of lifestyle are super important. Go ahead, next slide. So this is my last slide before we get to the one where I have some of my favorite references. This is an old picture of a doctor holding a cigarette, and I'm sure this was part of an advertising campaign from the tobacco companies. But it wasn't, it was, decades and decades ago, but not that long ago, when doctors would smoke in front of their patients. And it took a long time, even for the medical community, to acknowledge that nicotine and smoking specifically was causing cancer and increasing the risk of heart disease. But it was especially cancer that brought it to everybody's attention. And part of it is that as we went through medical school, those of us or whatever sort of healthcare training you went through, you're so focused, and the emphasis is on, for instance, looking for the signs and symptoms of cancer so we don't miss it, and then learning how to treat cancer. But learning nutrition and healthy lifestyle factors and prevention, that was not really high on the list of medical school courses that we had to take. And so it's not so much making an excuse, but what I'm trying to say is that as me as a cardiologist, as I'm continuing to try and stay on top of everything in the cardiology field, learning the importance of lifestyle factors and all of this nutrition data and research, I'm doing this all on my own. This was not something I learned in school. And so if you feel like you're not getting consistent information from your providers, it's because not everybody knows all of the recent data or knows all of this information, because you have to actually go out and find it. It's not usually emphasized in school. Now, there are some schools and residency programs these days that are focusing more on prevention, which is very, very encouraging. But if you feel like you're getting confusing and mixed messages from your providers, there's a reason why. Go ahead, Scott. So this is just a list of my favorite resources if you want to take a photo or a screenshot or something like that. These are some of the podcasts and books and documentaries that I feel like I feel are very well done and well researched and unbiased, and really are just a wealth of information. And I probably should continue to add to these, but this is just a short list. It's really some of my favorites. And then I'm open to questions if anybody has any.
I'll unshare here in a second, as long as everyone had a chance to take a picture of that. I'll stop sharing.
I wondered if the whole presentation is going to be on the website, or because it was so fast.
Yes, it will. It's being recorded right now, and I'll have it posted by tomorrow night, and it'll be in the class archives.
Okay, great. Thank you so much.
I have a quick question. A friend of mine had a pacemaker put in, and I figured because her heart wasn't beating right, and I know it's atrial fibrillation. Does the pacemaker balance? Does that make it better or what?
It's kind of a complicated question because pacemakers in general do not treat atrial fibrillation. But what it allows us to do is that if we have to be very aggressive with medications to slow down the heart rate, a pacemaker will prevent it from going too slow. And we see this all the time where we try and get people's heart rates to slow down because of the atrial fibrillation. It's through medications. But then there's this trade-off. Once in a while it goes too slow and we don't want people fainting and injuring themselves.
Right.
But then if we back off on the medications, then it starts going too fast and they go into congestive heart failure. So it just depends on what their what has been tried for your friend previously, and it may have come down to where they were kind of stuck between a rock and a hard place, that they had to put in the pacemaker so they could be more aggressive with medications.
Yeah, she wasn't doing well on the medication. She was really, it
Yeah.
was just not good. Well, she's 87. And
Yep.
so she got a pacemaker and she's feeling like she's got a new life.
Yes. And pacemakers are one of those therapies that I don't really believe that there's an age limit where you can get one, because while pacemakers can be considered a form of life support to a certain extent, more importantly, they are a form of symptom relief. They can make people feel so much better
Right.
and function so much more effectively than they were before they got it. I mean, there are people in their 90s we put pacemakers in, and it did, like you said, it gives them kind of a new life.
Yeah, but she just feels wonderful.
Good,
Yeah.
good.
So I had a quick question. It wasn't about what you said. I had I came back from Vegas and when I went to my doctor because I was coughing a lot, and she said I had influenza A. She gave me a couple pills, antibiotics. I'm just wondering how long the antibiotics stay in your system because I eat a lot of salads. Would it be a week? Would it be 3 weeks? I'm just kind of curious.
I mean, you can wipe out a lot of your GI flora with antibiotics the entire time you're on them. But if you continue to eat a plant-based diet over even days, 2 weeks, you can start to replenish healthy, the healthy colonic flora.
Good.
If you're feeling still that things down in your GI system are not quite back to baseline, I mean, maybe that will take a couple of weeks, but as long as you're eating healthy, you should be able to restore that balance. I would say within a few weeks, but it starts within a few days.
Well, this has been a couple months ago, so I'm just happy that it's in a few weeks because I eat really good. I
Good.
mean, I know what
Good.
killed my mother. I know what killed my dad. I know what killed my grandmothers. I mean, I know.
Yep.
So I don't want to go like that. I don't mind
Yep.
dying. I just don't want to go like that.
It looks like there's a question in the chat. How do you feel about HRV training? I don't know what HRV is.
Me either.
HRV, high resistance.
I asked that question. My name's Kevin. Hi. It's heart rate variation training. Heart rate variation and
Oh, is that similar to HIIT? High intensity interval training?
no heart rate variation is the difference in the heart rate, respiratory sinus arrhythmia, your heart rate
Variability.
variability when and so the difference between the faster rate and the slower rate is an indication of heart health.
Hey, I thought you were talking about training like an exercise program, so that's what threw me off. Got it. Okay. Okay, heart rate variability training. Okay.
Yeah.
I don't know the answer to that question because it depends on if somebody has I'm assuming you have paroxysmal atrial fibrillation.
Atrial fibrillation, yeah.
When you're not in it all the time.
Yeah.
And as far as any breathing exercises that help prevent you from going into atrial fibrillation, I've not heard of
Okay.
them. Yeah.
Okay.
I'm sorry. Yep. And then
Thanks.
Alice, how do you counsel your social drinker patients to cut back? I describe alcohol to my patients as kind of a low-hanging fruit. When they're looking at their overall nutrition pattern and they're kind of struggling with where to start or how to proceed, I have them start with what I call low-hanging fruit. And alcohol and snacks tend to be low-hanging fruit for most people because those are the things that seem to be the easiest to modify. Um, and so it depends on how much your social drinker is drinking. But ideally, in women, it should be no more than one beverage a day, and in men, no more than two. And what I usually tell people is ideally not every day. So if you have a female patient who's drinking 2 to 3 3 days a week, I say, okay, right there is a chance to cut down to 1 to 2 3 days a week, and then kind of eventually down to 1 3 days a week. And so you kind of give them, when it comes to nutrition changes, I really try and do it in a prescription format where you're giving very specific recommendations. So instead of telling somebody, well, you need to start exercising every week. That's not specific enough. You need to counsel people to, okay, I want you to start by doing, what is your favorite type of activity? Is it walking? Okay, it's walking. Do you think you'd be able to walk for 15 minutes at a time? Yes. Okay, great. 15 minutes at a time. Let's do 3 days a week. What time of day are you going to do it? Pick a time of day. At lunch, at work. You eat your lunch and you're going to go for a 15-minute walk after lunch 3 days a week. And that's their prescription. And then you can take it from there. So same thing with alcohol, same thing with any other factor, lifestyle factor that somebody's trying to either adopt or to decrease or change is come up with a very clear cut, like almost prescription of how to cut back or change it. Does that help?
Yes.
Okay.
Thanks.
Mhm. Anybody else?
I have a question. My name is Carol. I moved here from Colorado about a year and a half ago, and have been having some weird stuff going on in my hands where after sitting for a while, my knuckles from the first knuckle up, or my hands from the first knuckle up to my fingertips, just goes dead white. And I talked to my doctor about it. He told me it was Raynaud's disease, and he thought it was due to cold weather. I was wondering if there's a heart issue or a cardiac issue involved in that also.
I mean, it can be. Raynaud's disease can be also associated with things like migraines. And it can be most common like in cold weather because that causes the spasm of your blood vessels. It's possible that you could be therefore prone to spasm of your other arteries, but that's not clear cut. Um, my understanding with Raynaud's is that it's not a marker of overall vascular disease the way, say, erectile dysfunction is, like I was mentioning earlier. Um, because so many people can have Raynaud's, especially at very young ages, and know they don't have any other evidence of cardiovascular disease. So, as far as I know, it's not a clear-cut marker of any cardiovascular problems.
Okay, great. Thank you very much.
Yeah. I don't know, Scott, you're in primary care. Is there
Mhm.
anything I'm missing there? It's not something that I see very often in my clinic.
Yeah, I mean, I don't know of any, the same thing, any connection with that, but I know, I don't know if there's any studies on diet and lifestyle improving it. I know just traditionally sometimes calcium channel blockers can help it, but that's a type of blood pressure medication. But yeah, I don't know of any. I don't know if Charlie knows of any studies or if Dr. Greger has anything on Raynaud's on nutritionfacts.org.
Over the last
49 years. I've seen a lot of people with Raynaud syndrome, and I have rarely associated with any significant pathology. It's generally a benign issue, and I would not lose sleep over having that.
Okay, great. And it seems to be lessening over the winter. I was getting a lot of episodes, but it seems to be getting better.
Stress may bring it on a bit. As you kick out epinephrine, it can cause potentially a little spasming also. So that's something I've recently given some thought to.
Great, thank you.
So Aaron, you had asked about the calcium channel blockers for lowering blood pressure. Are you there? There's a message
Yes.
in the chat. Yeah. So there's two different types of blood calcium channel blockers. One type of calcium channel blocker also slows down your heart rate, and the other type just lowers the blood pressure. It doesn't do anything to your heart rate. So calcium channel blockers are really good blood pressure medications. They don't tend to hurt your kidneys or affect your kidney function. You don't tend to need to get lab work done. And they can be effective for other types of heart disease as well. That being said, about 10 to 15% of people on calcium channel blockers experience lower extremity edema, so swelling in their ankles and in their legs, and it can be kind of annoying. In some people, it's bad enough where they want to stop it. It just depends on how effective it is. You know, whenever I start somebody or I talk to somebody about their blood pressure, if it's not super, super high, if it's only say mildly elevated, I try and go over about 4 or 5 lifestyle things first, or external things first, that if they can reverse those things, they may not need blood pressure medications. So those tend to be avoiding anti-inflammatories with like ibuprofen, Aleve, Motrin, Advil, those sorts of things, because that raises your blood pressure. And it also independently increases your risk for cardiovascular disease. So trying to avoid those if at all possible. Number 2 is that if you have risk factors for sleep apnea, if you're feeling very sleepy during the daytime, if you've been told you snore heavily or you stop breathing while you're sleeping, you may have obstructive sleep apnea, and getting that treated can lower your blood pressure. Number 3, alcohol is a huge contributor. It's arguably the number 1 external factor that raises people's blood pressures. And so cutting back or eliminating alcohol. And then, of course, sodium in our diets. And so many people are unaware of just how much salt they're getting in, because most people say that they don't add salt to their food, like with a salt shaker. But usually you don't have to, because so much of the food that we eat, because it's processed, already comes loaded with sodium. So cutting back on the sodium is a big contributing factor as well. So those are like the 4 things that I go over with people before I start talking about medications.
And I think, in my experience with lifestyle medicine has been, that's one of the easiest medications to get people off of with diet and lifestyle changes. Been able to take a lot of patients off of their blood pressure medication pretty quickly sometimes too.
Yep.
Well, my doctor was saying to switch from, like Maxide to a calcium channel blocker, because I was having an episode of gout, and he thought that the Maxide would possibly be.
Yeah, can increase your uric acid levels. So, yeah.
But I was not too, and I have not started taking the calcium channel blocker, and I'm going to see him in next week. So I wanted to find out if there's any reason that I should tell him, no, I don't want this. That's why I was asking.
No, no, there's no reason in particular but everybody's different, and Maxide is a great blood pressure medication. So, some people might find they respond better to one than another. So,
Okay,
yeah.
thank you.
Uh-huh. And then Doug, I think you have your hand up.
Yeah. My daughter, when she's about 48, she's never had any chest issues, chest pain. And the one in the morning, the day that she took a COVID shot, she did. And I wonder if you've heard any association between the two.
Did she go and get medical help?
No, I
Oh,
guess it disappeared. I don't know. But
okay.
she didn't follow up on it.
Yeah, so so more commonly with COVID infection, but also with the COVID vaccine, but it's between the two, it was more common with the actual infection. There were problems, including life-threatening problems with something called myocarditis, where people who have no risk factors for cardiovascular disease got infected with COVID usually, and less commonly got the vaccine, and they developed chest pain, and they were found to have evidence of damage to the heart muscle. And that's called myocarditis. Itis, those last four words attached to anything like arthritis, bronchitis means inflammation of. So it was inflammation of the myocardium, the heart muscle. So myocarditis. And so we saw a lot of that during the pandemic. And unfortunately, some people didn't survive it. So anybody who has chest pain that's not going away within seconds, really ought to seek medical attention. We just hate to miss anything. If hers went away very quickly, well then, hopefully it was nothing even related to the vaccine. But anything that lasts more than a few seconds or a minute or two, that needs to be checked out.
Okay. I have one other question. I have a
Please.
AAA, and my doctor put me on statins, and I seem to be having issues with the statins.
Mhm.
And she switched me to different ones and then greatly reduced it, and I eventually stopped taking it. And
Okay.
through the whole food plant-based, I got my numbers down really low.
Oh,
but,
good.
But what would you say, how low should I should be able to maintain them and not take the statin?
Um,
'Cause I think about going back on it.
Yeah, the reason an abdominal aortic aneurysm is a form of vascular disease. It tends to be really triggered by high blood pressure. So the first and foremost is making sure your blood pressure is controlled. And then second is that because it's a form of vascular disease and it can be worsened if you have plaque built up in your vessels, that's where the statin comes in. If your cholesterol is down, your LDL cholesterol is down nice and low, if I were seeing you as a patient, I would prefer it to be under 70. But if you could get it under 100, that would be probably acceptable, because it sounds like you were having bad enough side effects that it just wasn't, that's not worth it. It's too, people can be just so miserable on statins with the side effects that it's really not worth the small benefit you're getting from taking it. So in the case of an aneurysm, though, making sure that blood pressure is very well controlled is more important. And then if your LDL is not coming down, and even with a whole food plant-based diet, then there are alternatives that you could consider.
Okay, thank you.
Yeah, you're welcome.
Go ahead, Carol, unmute.
Okay, thank you. I have one more question about heart rate. I check my blood pressure from time to time. I've had a pretty stressful year, and my heart rate is often in the 50s. I'm female, 74 years old, and just when I told somebody that, they said that's the heart rate of a well-trained athlete, which I'm not. I mean, I do take good care of myself. For most of the past year, I've been walking on a regular basis, 45 minutes to an hour, often 5 or 6 or 7 times a week. So
And you feel well doing that? Like you can go and exercise for that long and at a brisk pace and you feel fine?
I do.
Feel good. Yeah. Yeah. A heart rate in the 50s is great. It's very healthy. You're doing well as long as you're not having any symptoms. It,
What might symptoms be for
well,
low?
it would usually, if your heart rate's getting too low, and I'm talking about heart rates usually in the 30s,
Okay.
when you're just getting up and moving around your house, if your heart rate's in the 30s, maybe low 40s, people can feel exhausted, just profoundly exhausted, short of breath, just no energy and short of breath. And then, kind of the worst symptoms are severe lightheadedness or actually fainting from it. But having a resting heart rate when you're just relaxed and resting in the 50s is actually very good and very healthy. The big thing when you've got a resting heart rate in the 50s, the most important thing is that when you want it to increase, you want to go and hike up a steep hill. So you need your heart rate to get up to 110 or 120 or 100 to pump through give you enough circulation to make it up that hill. You want your heart rate to be able to do that. As long as your heart rate can do that and you're feeling fine doing those activities, great. Then when you come back and rest, then your heart's resting also and it's beating 55 or 52. It's fine. Yep.
I'll take that off my list.
Yep.
I appreciate.
Yep. Jerry, I said vinegar. So Caldwell Esselstyn mentions putting a little balsamic vinegar on your steamed greens because it increases the acetic acid in the vinegar, increases the enzyme in your body that produces nitric oxide.
Other questions, comments, anything from anybody? You get to do it again on Sunday, Kristin. At the Vegan Fest, she's speaking there at the Lane Event Center on Sunday. Hopefully, again, you guys can come out if you're in the area. I know we have some people coming up from Roseburg, from UC Veg. I know there's people coming down from Portland, Corvallis, Albany.
You want to mention movie night? Oh, first Doug.
What's the doctor's name? That picture you showed of the arteries, coronary arteries.
Dr. Caldwell Esselstyn.
Didn't I read one time doesn't want you to use fluoride toothpaste because it kills the microorganisms? And
yeah, there was mouthwash. It was mostly mouthwash, not so much fluoride. I think it's like using Listerine mouthwash kills some of the bacteria in the mouth and the tongue, specifically the crypts of the tongue, is where a lot of the bacteria live that help convert from nitric to I can't remember, nitrite to nitric, or can't remember the reduction to convert it to the nitric oxide. So it's best to not use the mouthwashes. Yeah.
It's kind of problematic when you're telling us to eat onions and garlic.
Yeah.
Yeah.
Well, so actually, really, just it's more like the alcohol. And there's mouthwashes that don't contain alcohol.
Well,
Just freshen your breath, so that's less harmful to your oral flora. And in fact, the alcohol-based mouthwashes are actually can contribute to periodontal disease, can cause uh, significant gum disease, and all of because it dries out your mouth, your mucous membranes, and can be really harmful. So it's more the alcohol-based mouthwashes. If you want to freshen your breath after you eat your cloves of garlic, there's I prefer ACT, ACT, and it's a non-alcohol based mouthwash.
okay, thank you.
Yeah.
Yeah, and on Saturday is the Saturday night, May 3rd at the Grange. We're doing a movie night, and we're going to show the documentary called Food for Thought. We'll be serving popcorn there. Also the grocery store shopping tour on May 15th is coming up. So at Winco Foods in Springfield, that one requires sign up. I have it in the newsletter. You can send me an email
Is Sean
if you want
doing
to
that
do
one?
that. It's gonna be Karen Booth this time.
Okay.
Yeah.
So, Dr. Linzmeyer, this may be a little uncomfortable for you to answer the question about stents and bypasses for people who are not in the throes of acute MI.
Mhm.
As to your thoughts about this, I know what Gregor's thoughts are, that, tends not to prolong people's lives. And I don't know what your thoughts are.
I guess
Why
I don't
we're
know what
doing
the question is. What do you mean?
stents, bypasses for people who are not
Oh,
in the
not having a
throes,
heart attack. Okay.
not having a heart attack, but wind up having these procedures done,
Yeah.
um, as opposed
Yes,
to,
correct. That is,
making healthier lifestyle choices.
yep.
I mean, why are so many still being performed? And
I don't know. I mean, my experience in both my former practice and here is that we don't tend to go and look for obstructive coronary disease unless people are having symptoms. So if people are having unstable symptoms, and so, maybe they haven't had a heart attack, but if they're having unstable symptoms despite medical therapy, there is some benefit. But just for stable angina, it's it's not it's not recommended unless you're failing medical therapy. And so, I've got a patient right now who's got a really, really high cholesterol. He has angina, but it only happens with certain activities. He doesn't need a stent. And, I'm trying to get him to do more of lifestyle. A number of recommendations I've made that I'm trying to kind of talk to him about his choices. So, but yeah, in my former practice at St. Luke's and here, I'm not seeing many people, myself or any of my partners, who are actively putting in stents in people who are not having a heart attack. And Dr. Greger's absolutely right. There's no mortality benefit. So there is a possible benefit for symptom relief. So if you get a stent, you usually feel better right away, but you have to be on a handful of medications when you get a stent. So your symptoms go away usually right away. You can achieve that same benefit of having your symptoms go away through medications and lifestyle. It just may take a little bit longer. But yep, no mortality benefit if people are stable. You're right. Yeah. And I think most, again, I'd like to say it's most cardiologists, but obviously not all, try and practice that way. But I'm sure it doesn't happen everywhere.
thank you.
Uh-huh.
Any last question? That was great. Loved listening to you again.
Wonderful and informative. Thank you so much.
You're welcome.
We're really lucky to have, such an informed cardiologist here in the community to be able to share with you guys. It's very a rare occurrence and a real treat to have you. So
Thanks, Scott.
we have, she's on the About Us section on the Live Lifestyle Medicine website, and I have her contact information there. It gives a link to her page on Peace Health where she works. So
You also on her, I don't know, Kristin, did you put a slide at the end of your presentation with your contact info?
No, just the Peace Health. Yeah. Just the
Okay,
Peace Health info. Yep. Yeah, I can do that for the Vegan Fest. I can add one with my Peace Health info for people to schedule an appointment.
great.
Right. All right.
All right,
Thanks,
everybody.
everybody. Have a good evening.
Thank you.
next week is diabetes.
Okay.
All right. Have
See
a
you
good
all
night,
then.
everyone.
See y'all later. Thanks, everybody.
Night.
Bye-bye.